today's session. Myself Rajita, and in this session, we are going to discuss about a very important and interesting topic of medical surgical nursing. Here, basically, the topic which we are going to deal today is considered to be one of the most commonest emergent condition which always almost find on a clinical setup. Now, this condition is known as airway obstruction. So, as the name itself is suggesting, the airway obstruction, it does mean we are going to see the airway of an individual will be getting obstructed. Or we can say there will be any kind of component present which will be obstructing the airway. And as you're understanding, if there is presence of any obstruction or any elements which are affecting the respiratory process or basically the airway, definitely we're going to see the client will be present with deficiency of oxygen in their body, because here in this case we are going to see the oxygen inspiration of the oxygen will be getting altered. Even the expiration of the carbon dioxide also will be having effect. That is the reason why we're going to see the airway obstruction will create a sudden emergent scenario development. So let us study now about what basically this airway obstruction is, how come it can affect an individual. So in precise, what are the etiological factor can be related with this particular condition. Next, definitely we're going to see what are the clinical manifestation through which we, a medical professional, can understand the type or the severity of the obstruction and decide the adequate management and treatment for the patient with this particular emergent condition. So let us study now what is an acute airway obstruction means. So, airway obstruction is generally a blockage that is affecting your airway and also altering its functional ability. We're going to see majority of the cases the upper airway obstructions is the most common type of airway obstruction. So, as we know that our respiratory system, basically our upper respiratory system, will be consisting larynx, even nasopharynx, we can see nasopharynx, oropharynx, and laryngopharynx also a component of the upper airway tract. We're going to see there will be presence of trachea, and ultimately the lower respiratory system will be consisting of two lungs, which will be doing the major function of the exchanging of the oxygen and carbon dioxide within the blood circulation. And through the upper airway, we have seen the person will be inspiring and expiring the oxygen and carbon dioxide respectively to maintain the normal level of carbon dioxide and oxygen in their body. So in case where the upper airway obstruction is the major common problem, we are going to see some cases or some disease condition which will be often causing the obstruction will be ultimately seizing the activity of the airway, and definitely the patient will be having in a state where there is lack of oxygen will be complained. So as I have mentioned, the upper airway always consists of trachea, larynx, that is our voice box, and basically the throat, basically the part of the pharynx. Now the blockage in any of this part is termed as the upper airway obstruction. Now, as we know, as a result of the lack of oxygen in the body because of the airway obstruction, we're going to see the person may have developed with certain complication. Now, even it can happen that the person may go for a sudden heart attack, or what we call it as congestive cardiac failure. Even there can be development of lack oxygen state in the brain, which will be ultimately affecting the brain tissues and its activities. Now, any obstructions of the airway is considered to be life-threatening. Now, obstructed airway need a very urgent and emergent treatment and management. Until and unless the treatment is being initiated, a person may develop with a life-threatening scenario, which even can go for death. Now here we're going to learn about what are the basic causes which can occur or which can be lying behind for the development of airway obstruction. Now, there are three major common factors, or we can say disease condition, or we can say scenario, which almost always will be associated with the development of airway obstruction. Now, these 3 points includes the presence of anaphylaxis, croup syndrome, epiglottitis. So these three are the considered to be the commonest type of disease or disorder which often will be related with the condition development of our airway obstruction. Now there are certain another factor which is almost every time commonly associated with the obstruction is choking. So, choking is basically, or majority of the cases, we are going to see the choking can occur because of the, inhalation of a foreign object or maybe a food product. Now, if the food product and foreign object is seizing the airway and its space where the inspiration of the expiration of the air occurs, that definitely will be causing ultimately a complete cessation of the air circulation and blockage of the airway, which ultimately can reduce the oxygen level in the body of an individual. So through which the person will definitely present with the sign and symptoms, which will be indicating that the person is having a airway obstruction. So now we are going to read about each of the condition one by one, how it can cause the airway obstruction. So first we are going to learn the terminology of anaphylaxis. So I hope you are well aware about the term anaphylaxis. It is nothing but a severe allergic reaction that is occurring in individual's body. So, as in this type of condition of anaphylaxis, a person's body will be having a severe allergic reaction to a particular allergen. Now, because of the severe allergic reaction, we are going to see there will be inflammation or the swelling will be occurring throughout the airway, which will be ultimately interrupting the air circulation or which will be ultimately collapsing or obstructing the airway. That is how a person may develop with an airway obstruction associated with anaphylaxis. Now, during the anaphylaxis reaction, as a part of the allergic reaction to occur in the body, we are going to see the inflammation will be affecting the airway tract. Now, the allergens can be any of the food product that are very specific to person who are allergic towards it. It can be certain medications like, for example, penicillin, which also can cause the anaphylaxis reaction to occur. Even the products like latex and associated device also sometimes can cause the allergic reaction to occur for an individual. That is the reason, even if a person is present with mild anaphylaxis or mild allergic reaction towards any allergen, it is very urgent to have a clinical assessment for that particular individual, because it does happen almost always that as an allergic reaction, a person can actually develop with the inflammation and the swelling development in the airway tract, which can suddenly cause a life-threatening scenario development. So to prevent the complication or the life-threatening scenario, it is indicated that if a person is having even a mild symptoms of allergies, or if they're having any symptoms associated which is indicating anaphylaxis, that needed to be treated in a clinical setup as soon as possible. So now we are going to learn about the epiglottitis. So you might have heard this terminology of epiglottis while reading about the anatomy of respiratory system, right? So even I hope you have learned about the epiglottitis even in case of respiratory system related disorder too in detail. So here the epiglottitis is nothing but the inflammation of the epiglottis. Now, as we have learned before, that epiglottis is nothing but a muscular flap, right? Or a skin flap which is present in the airway tract, and which is covering the windpipe. Now this will be opened when there is need of the oxygen or air to pass from the windpipe. Otherwise it will be getting closed. So that's how basically the epiglottis will be helping an individual to maintain a patent airway while drinking or while having a food or swallowing a food. Now, this epiglottis, if there is any infection present, or because of the invasion of any infectious pathogen, or because of drinking some hot water or some hot object, if it has affected the epiglottis, we're going to see the infection or the pathological process can affect the epiglottis, which will be ultimately causing an inflammation of this flap. Now, once there is inflammation present in the epiglottis, definitely the opening and the closure of the epiglottis will be restricted. And if the inflammation is severe enough, it even can close the opening of the windpipe. So that's how a person may have undergone a epiglottitis, and where the whole windpipe will be choked because of the inflamed epiglottis. And definitely here also we are going to see the airway obstruction is occurring because the opening or the above portion where the air basically circulates or enters to the windpipe is closed here. So definitely this epiglottitis ultimately will be causing our airway obstruction, where a person may present with the symptoms like lack of oxygen in their body. So next is croup disease. So croup is a condition usually which characterized by a hoarse and working cough. Now this condition generally occurs because of the inflammation of the vocal cord or inflammation of the windpipe. Now, croup can be associated with any infections, disease like influenza. Even it can cause because of certain object or allergic or object too. Now, as there is presence of swollen windpipe, so definitely we're going to see there will be vibration into the vocal cords even, and which ultimately will be turning into the development of obstructed airway. So this croup disease, if it is not managed at earlier, we are going to see this also can cause the development of airway obstruction. Now remember, croup is not a very severe condition. It can be managed even with the home remedies or with very minimal medical treatment. But what I mean to say here, if the croup disease is neglected, not treated, or the home remedies are not initiated at earliest, as there is presence of the swollen or inflammation of the windpipe, that ultimately can cause a complete obstruction of the windpipe, which will be again causing the respiratory discomfort, and ultimately a person may present with a decreased oxygen level. So now we are going to see the next condition, which is almost always and commonly associated with the development of respiratory obstruction or airway obstruction. Now, this foreign objects definitely or a foreign object associated respiratory obstruction often occur in the age group when the person is in toddler or small children like infant or the school going age group, because in this time generally the person won't be having a idea about the eating pattern. Now often almost we are going to see the toddlers will be complaining regarding ingestion of varieties of object. Now if this object is somehow got stuck to the windpipe, now this can ultimately cause obstruction of the air passage. Now, food object ingestion, which and associated with the development of obstruction, can occur in any of the ages. Sometimes it happens with the adult while having food. If there is any alteration while in the activity of the food pipe and windpipe, we're going to see that ultimately can cause dislodgement of the food product into the windpipe. In this case, where we are going to see this foreign object or food product will be obstructing the airway. So ultimately, this can leads to the development of an emergent scenario where a person need to manage in a clinical setup in order to take out the particular foreign object from the windpipe or from the respiratory tract. So I hope till here you understood the whole concept of the respiratory obstruction. Now, it is a very important point to note down that respiratory obstruction even can be associated with varieties of systemic disease which is associated with the respiratory system and respiratory tract. Now, some cases where a person is present with a severe pneumonia, or maybe the sputum production is so much increased because of any underlying pathological disease like tuberculosis, can cause a complete obstruction of the airway, because the windpipe here can go under inflammation. Even it can go under the dislodgement of, or the obstruction of the windpipe. Here also the person will be present with the similar sign and symptoms, which is basically caused because of the lack of oxygen in the body. So I hope till here you have learned about the etiological factors as well as the pathophysiological process, and you have understood the basic concept that how this whole part is going to affect our respiratory tract and can cause the development of the obstruction. So now, as we have learned about the etiological process, we are going to learn about the common symptoms which almost always will be present on a client who is present with a airway obstruction. Now remember, the learning this clinical symptoms is a very important part, because as medical professionals we should be well knowledge about the clinical symptoms which is indicating an emergent situation, so that we can initiate the early treatment to manage the client with airway obstruction and save the client's life, as well as we also can prevent the complication development associated with airway obstruction. So majority of the client, we're going to see the clinical symptoms will be including agitation and confusion in the primary stage, where only the person is present with the obstruction. They will be very much agitated, anxious, and they will be in a panic stage. We're going to see the client will be present with abnormal coughing. Even there can be present of wheezing or other unusual breath sounds. The person will be present with abnormal coughing as well as dyspnea, that is difficulty in breathing. Almost always a person will be trying to show that something is choked in their airway. So almost always a person, basically with foreign object choking, a person will try to hold their neck in this way. So I hope you are seeing in the picture over the slides that that is how a person will try to show that they are having choking, right? In a later session of this airway obstruction, even a person can present with drooling, as well as the person can be in an unconscious stage. Now, if the client is in an unconscious state, it is definitely has to be assessed whether the person is having a patent airway or not. So these are the basic symptoms which almost always will be present in patient with airway obstruction. Majority of the client, they will be showing a swollen face, even tongue, and their lips can be swollen here. The person will be showing the symptoms of choking by holding their neck. They will be having abnormal coughing and abnormal breath sound, basically the wheezing associated with airway obstruction. Now, cyanosis can occur in case of acute airway obstruction, where the obstruction is very severe, that the whole airway passage is obstructed and the complete oxygen cessation has been taken place. So that definitely the client will be acutely developed with oxygen deficiency in their body, which ultimately will be causing the development of cyanosis, which also a very good indicator that the person need to be assessed for the airway, and definitely they should be initiated with earliest. So as I have mentioned, the cyanosis will be definitely depending on the severity of the obstruction and duration of the blockage. The majority of the client with partial obstruction won't be showing the feature of cyanosis at earliest stage. But in case where the person is present with a complete or almost 90% of the airway obstruction, definitely the client can be developed with the cyanosis at initial phase. Now, cyanosis occurs when there isn't enough oxygen in the blood. It does indicating that the client needs a emergent treatment procedure to be performed. Now, as there is presence of lack of oxygen, we're gonna see even the skin, the lips, and the fingernails are the primary area where the cyanosis will be developed. So, if a client is present with any minimal symptoms of choking and they are present with the bluish discoloration in the fingernails, toes, or into the lips, they definitely need a very urgent treatment to be initiated. Now, we are going to learn about the basic concept of the emergency treatment, which we will be initiating in case of a person who is suffering from airway obstruction. So first we're going to learn if there is any anaphylaxis associated airway obstruction, what are the management to be taken care of. So you need to understand that anaphylaxis is a severe allergic reaction. So once you are understanding that the client may having the feature of severe allergic reaction, it is considered to be having life-threatening consequences. That is the reason anaphylaxis requires immediate treatment. Now, if we are assessing someone and if we are understanding that someone is having the anaphylaxis reaction, we should transport the particular client into our healthcare setup. Now, generally, initial treatment includes the oxygen administration, the administration of antihistamine and anti-inflammatory medication. Now, with a known history of anaphylaxis for those clients, generally an auto injector will be provided to them. Now, the auto injector syringe would be generally consisting with pre-measured dosage of any emergency medications. Now, these emergency medications can be epinephrine or either adrenaline. So, a client who is a known case of anaphylaxis or having a severe allergic reactions, definitely this auto injector will be provided to them, and they will be instructed to carry this auto injector everywhere. So once there any indication is present where they have got exposed to any allergens or they are having any mild symptoms associated with that, it is instructed to them to administer this particular pre-measured drug consistent auto injector. So the administration of epinephrine here plays a very important role, which minimize the development of the anaphylaxis reaction to occur. Even this particular medication can decrease the severity of the anaphylaxis reaction. That's how a person will be managed with the inflammation of the airway associated with anaphylaxis by reducing the anaphylactic reaction and its severity. Now, majority of the client with this condition will be suggested to reduce the exposure to the allergens even, which is a preventive measure to manage the condition of upper airway obstruction. So I hope you got the idea that in case of anaphylaxis, that's how with antihistamine or anti-inflammatory and oxygen administration are the primary treatment procedure which is to be followed. The detail of the anaphylaxis reaction and treatment will be discussed in later session, so you can have a clear idea that how the anaphylaxis reaction will be managed here. So I hope you are understanding the upper airway obstruction will be generally treated best on the etiological factor which is causing the development of airway obstruction. So next we are going to learn how, if the client is present with airway obstruction associated with epiglottitis, how we are going to manage that particular client. So generally we are going to see once the client is present with epiglottitis, the first and foremost important part of the management is to ensure that the client is managing their oxygen level. So oxygen administration here would be done through a breathing mask or through the insertion of a oxygen tube. Now here, generally if the epiglottitis is associated with any infection, antibiotic regimen should be initiated once the diagnosis is finalized. Otherwise, the treatment would be referred or focused on the underlying causative factors which is causing the epiglottitis. So managing the epiglottitis will be definitely reducing the chances of the development of airway obstruction here for the client. Now we are going to discuss the management and treatment associated with croup. So often the croup syndrome can cause a alteration into the airway, and it can cause the inflammation into it, which will be leading to the development of airway obstruction. We have already learned. Now this syndrome of croup generally is manageable. So it is not a severe condition to be safe. So the home remedies should be initiated at earliest. So whenever a person is having the presence of any working cough or severe distinctive cough or any discomfort and vocal cords abnormality, definitely we should start with the home remedies. Now generally the home remedies includes inhalation of humidified air, or even the steam inhalation here plays a very important role. Drinking plenty of fluids, basically the water within the normal temperature, here definitely helps a person to manage with the croup syndrome. So these are the home remedies how we can actually treat the croup and manage the croup in the home setup only. Now, if these home remedies are not effective enough, definitely a person should not neglect the croup syndrome. They should approach to the physician to get the medication. Now, generally, the common medications which are usually used here includes corticosteroid, which definitely maintains and manages the inflammation associated with croup syndrome. The second major important part or medications which are often used here are antibiotics. Now, if the croup syndrome is related to with any infectious pathogenous organism, definitely antibiotic regimen would be prescribed to the client. So once the client is having even a mild symptoms associated with the croup syndrome, they definitely should start with their home remedies, as well as they should consult with a physician to prevent the airway obstruction. Now, it is a very important point to note as the children will be having, compared to the adults, they will be having narrow and short airways. So if the child is present with any abnormal sound associated with inhalation and exhalation, even if they are in a state of agitation, if the client is showing the struggle while breathing and definitely they are having anxiety, we need a immediate medical treatment to be initiated, because these are the indication which is suggesting that the client or the children is may have developed with the croup syndrome or associated airway obstruction. That is the reason immediate medical management and treatment is very much important in this stage. Now we are going to learn about the management of foreign object associated airway obstruction. So as we have learned, this is a very common problem. Majority of the cases among the children, it is a very prevalent condition where ingestion of any foreign object or any food product can cause the airway obstruction. So if the child have already ingested a foreign object, or if they are showing the symptoms associated with airway obstruction but you are not sure about the ingestion of the foreign object, they are not able to cough, speak, even breathe, they're struggling, it definitely needs a immediate emergent treatment. So emergency treatment should not be delayed here. Now it is our responsibility to bring the children into the clinical setup as soon as possible without delay. Now if the child is 12 months and older than that, American Red Cross generally suggests to perform a emergent management in the home care setup only to manage the emergency situation before bringing the client to a clinical setup. So what is the American Red Cross suggest is we should administer 5 blows with our hand into the back of the particular individual. So whenever there is a victim who is more than 12 months of age, we should provide this 5 heavy blows inside the back. So generally these blows by the hand will be provided into below the shoulder blades into the back. Generally, the heel of the hand here will be used. So I hope you in picture you are able to understand how we are going to provide the blows in the back. Now the blows when providing it should be strong enough, but it should not be painful for the victim. Once we are providing this 5 blows, that it should be followed with 5 abdominal thrusts. Now this maneuver is known as Heimlich maneuver, which will be followed the steps as, so first we need to stand behind the victim and we should wrap our arm through their wrist. So we should place our thumb just beside the belly button of the victim. So first here we should stand behind the victim and we should wrap our arm through their wrist. The second step is we should create a fist, and that fist has to be kept just above of the belly button of the particular victim. Now the third step includes usage of a quick and upward thrust. Now we should press our fist within the abdomen and we should give a upward direction first in case of victim if they are present with a foreign object related airway obstruction. So as here in the picture you are able to see, that is the position where we should stand and we should create our fist and keep it just above the belly button of an individual, and we should provide the upward and forceful thrust. So we should be alternatingly doing the back blow and we should start to provide the abdominal thrust continuously in a cyclic manner before the emergent assistance is reaching to you. So in case of an infant who is younger than 12 months, we should not use the Heimlich maneuver for them. Rather than that, we can provide back blows and chest thrust to them. Now, to provide the back blow, we will be keeping the infant face down along with our thighs, and then with the usage of our heel of the hand, we will be providing the back blows into the center portion of the back of the individual. Now, to give the chest thrust, we should lay down baby face up according to our thighs. Now, in order to provide the chest thrust, we should use the 2-finger method and we should give 5 sharp chest thrusts upwardly in the breastbone or in the middle of the breastbone in order to make sure that the client may have completely all right with the airway obstruction. So through this back blow and abdominal thrust or back blow or chest thrust actually can leads to the reduction of the airway obstruction with the foreign object. Now if it is not managed with this maneuver, definitely as I have mentioned, definitely we should not wait till the procedure is over. We should call for the emergency assistance. Once the emergency assistance is reached there, definitely in a clinical setup, if the maneuver are not working and effective enough, we will be managing the client with the oxygen administration, and maybe an emergency surgical procedure will be performed to manage the airway obstruction and to bring out the foreign object which is causes the obstruction. So as I have mentioned, the children and infants are considered to be the highest risk group for the foreign object associated airway obstruction. That is the reason it is our responsibility to educate their parents to be very careful when they are handling with a very small objects. So associated with all the symptoms which I have mentioned, like choking, drooling, wheezing sound, difficulty in breathing, agitation, a panicky state. Associated with that, even a person can present with excessive vomiting, a gagging reflex or increased gagging reflex. Chest and throat pain, refusal to eat also can sometimes indicate that the client may have associated or may have a foreign object ingestion associated with airway obstruction. So, in some cases where the foreign object and the placement of it is not so sure, within a clinical setup, a medical professional may perform certain diagnostic studies to identify the location of the foreign object associated with airway obstruction. So, a X-ray even can be done. Bronchoscopy also sometimes can be performed in order to find out the location of the foreign object, and also these procedures helps to conclude the diagnosis and manage the condition in a very effective way. So, in case of a patient who are unconscious and not only the airway obstruction, but they are also present with alteration in the breathing pattern and their circulation, definitely cardiopulmonary resuscitation will be a treatment of choice. Which will be provided in this emergent situation to maintain their airway, breathing, and circulation. So, detail of the cardiopulmonary resuscitation has been already discussed. So, we will be following the perfect approach depending on the client's age, and we will be managing and trying to stabilize their circulation, airway, and breathing. So, in a home care setup where the client is already have a history of airway obstruction episodes, definitely we should take care of the client in a very accurate way. So, it is the responsibility of a nurse to teach the caregiver of a client who have already gone through the airway obstruction. The educating the client and their caregiver will be depending on the reason or etiological factor because of what the client have undergone the airway obstruction episodes. So it is our responsibility to teach them to continue the medication and treatment regimen whatever has been followed, to continuously perform the follow up at a regular interval. It is also responsibility of us to help them to understand the nature of the disease which has caused the airway obstruction, the probability of its recurrence, as well as we will be teaching the client and the caregiver regarding sign and symptoms which may considered to be the indicator of a complication development of a development or airway obstruction further. So, assessing those symptoms and reporting to the emergent medical setup is very much important part here to manage the airway obstruction and associated condition. There is a reason here teaching the client should be adequate enough. Even the caregiver of the client should have adequate knowledge related to the management and emergency treatment available to manage the airway obstruction. Now, as I have mentioned, often intubation and tracheostomy also can be performed to manage the client in case of airway obstruction. So, in some cases where the chronic disease condition is causing the airway obstructions development and the recurrence rate is high, we may perform a tracheostomy to make sure that the client is maintaining an adequate oxygen level. Now we are going to learn about the nursing management. So definitely nurses have a major responsibility here to collect the data accordingly. So by performing a history collection and physical examination, through which the nurses would be understanding the actual causative factors which is associated with the development of this condition of airway obstruction, as well as they will be understanding whether there is presence of any allergic reactions for the individual. So that is how a nurse can help an individual to prevent the exposure to the allergens, as well as through the physical examination. Our nurses here would be recognizing the physical need of the client. So in case of emergency, before even performing the history collection and physical examination, our nurse is supposed to perform the emergent resuscitation with the usage of cardiopulmonary resuscitation technique. Even in clinical setup, the Heimlich maneuver can be performed, or maybe a back blow with the chest thrust or abdominal thrust may be performed for the client depending on their age. So other nursing interventions include, once the emergency scenario is managed with the proper treatment and adequate intervention, the next step of a nurse is first providing a client a very comfortable position, preferably high followers position or a sitting position. Usage of comfort devices, side pillows should be ensured by a nurse to promote their comfort. Now, if the inflammation of the airway or airway obstruction is related to some underlying disease condition, incentive spirometry usage of this particular device helps the client to increase their oxygen level and breathing pattern for them. Frequent ambulation and position changes almost always indicated to the client with acute or airway obstruction if there is no other contraindication or physical contraindication is present. So nurses here plays a very important role to continue the position change for a client as well as for early ambulation. Now, definitely, adequate nutrition and hydration here will be ensured by the nurse. Adequate rest and sleep should be provided to the client. Naturally, the client after the episodes of airway obstruction will be in a panic stricken stage. So that is the reason providing a calm and quiet environment here is very much necessary by the nurses. So we need to teach the client and educate the client and their caregiver regarding the treatment plan and the rationale behind the treatment plan. As well as we should discuss about the nature of the condition depending on the etiological factor which is causing the development of airway obstruction. Now, in case if it is associated with any allergic reaction on anaphylaxis, we should definitely teach the client regarding the anaphylaxis, and we should also guide them to prevent the exposure towards the allergens. In most of the cases, nurses here would be teaching the client about the cuffing technique and deep breathing technique, which is a very effective treatment regimen to maintain a patent airway. Now, if the tracheostomy is indicated and performed, often we are gonna provide the tracheostomy care. Now, in case of chronic patient, we will be teaching the client basically to their caregiver about the tracheostomy care and the equipment handling. So even we will be teaching here regarding the continuation of the follow-up of the treatment regimen. So that is how our nurses plays here a very important role to manage the client with airway obstruction. Even they have a role as a preventive measure and promotive healthcare provider. So I hope you have got a complete idea about the topic of airway obstruction here. So as the airway obstruction can be an emergency situation, it does need a very effective management and treatment to be initiated. Even the symptoms should be recognized at a very early stage. Then only the client can be managed with this condition of airway obstruction. So I hope you have got the idea about the condition of this. I hope you have enjoyed the session. Thank you so much for attending this one. We will be meeting you guys in the next session.